launching two new products, Deep Pumas and Ask Pumas. While I can talk about products all day, the real thing that I want to talk about is the people behind it. It's about how, as a global team spread across 18 countries, we all came together to build something extraordinary. And the reason I say extraordinary is because the more we build, the more we were fascinated by ourselves, right? The journey of Deep Pumas actually started back in perhaps 2018, not in a fancy conference room or at any keynote session, but in a simple hallway conversation with Chris, when we were bouncing off ideas about how to, you know, improve model development timing. And at that point, scientific machine learning was still a very new concept, and we saw potential in it. But what was an idea was really pulled together and taken forward by the team behind the two products that we're launching today. Nicholas led the Deep Pumas team, the initial designs of with countless hours of iterative work. He translated the grand vision that we had into a tangible product, overseeing the initial stages of the development. And there were many others who joined him over the last few years. And I would like to thank each and every one of you who contributed, even if a single line of code, all those long discussions that never happened over a coffee break, that never happened over a conference room setting. They were all online with our kids running around during the COVID time. We had our moments, but we had fun. And the same with Ask Pumas, what we thought to be pretty much exploratory project that we allocated 6 months for turned into a reality in just 3 weeks. And it was delivered by one of the youngest members of our team, Juan Honito, who is on the call today. And while I can talk a lot about this, I don't want to take the limelight away from all of this because the people behind the team are going to be talking about what does it mean to them and how we at PumasAI are shaping the next generation of pharmacometricians, the next generation of tooling that pharmacometricians need to use. And just to sort of lay the transition into it, I would like to introduce, a lot of you probably know on this meeting today, Chris Rackauckus. Chris, it is great to have you today at the Deep Pumas launch event.
Yeah, I'm so excited to be here.
You were with us during the initial Pumas launch back in 2021, right? And you have seen the ecosystem of Pumas and Julia grow.
Oh
More
yeah.
importantly, you have seen the community and the folks behind this that deliver. How excited are you about today? And can you tell us a little bit about the background work that is happening in the open source world and how Pumas and Deep Pumas have come to fruition?
Yeah, I'm so excited today about the launch of Deep Puma since it's really the true culmination of, the software that we dreamed of with this IML open source ecosystem, right? We dreamed that there was all these ways to incorporate machine learning into the processes that we know. And, this is really the one that said, it's not a toy anymore, right? This is really taking it to being a real industrial problem with the robustness and all the support behind it to be able to translate that to, solving these real problems in the world, right? So, yeah, I mean, when we came together with the creation of Pumas, like the goal was to build software that would accelerate the process by which drugs are analyzed and understood. And, we know that's a multifaceted problem. There's improved workflows and, faster solvers. And we've focused on a lot of these parts, right? But, working with a lot of customers, we always, there was always this nagging problem. It's just like, oh, we have to have a model and then we can do things. We have the model and then we can do things. And so, yeah, it was really just this working with all these folks in the community. There's this question of, could we build software that helps you get to that model faster, right? Could we assume that you don't have to have a perfectly correct model and everything? Could we give you something where you just say, oh, you had a okay model, but here's the literature you want to look at. Here's where your model is likely incorrect. We correct your model for you. And that idea that the way that you interact with your tooling doesn't have to be post model, but it could be helping you build the model and helping you understand the drug dynamics. That's really was the core of what created the idea behind SciML. And of course, it took a long time for this to come into fruition, right? We had to grow in many ways to be able to make this possible. There's been a lot of work in the open source community in differential programming, numerical differential equations, high performance computing, and the integration of machine learning. I mean, at this point, the SciML project has grown to be, it's a NUM-focused sponsored nonprofit organization. It has 200 Julia packages, averaging 50,000 downloads a month. We have more than 100 unique contributors contributing to the project from all around the world. But it really has been centered at, MIT, Julia Hub, and of course, a lot of the folks at Pumas-AI who have really brought together, this underlying tooling to make it possible. So, it's been almost a decade now since the first versions of differential equations.jl. We got this battle hardened, with the folks, Yingbo Ma, Vaibhav Dixit, David Widman, Samuel Isaacson, and so many more contributors have really battle hardened this into an ecosystem that can connect to machine learning in a way that is actually, a real system that is doing both the models and the machine learning. And so that really brings us to today, right? I think it was might have been ACOP 2019 that we first showed people, that pharmacometrics could possibly be automated with these scientific machine learning techniques. And
Yeah.
the team at Pumas-AI has really refined the methodologies, improved the robustness. There's folks, Mohammed Tarek, Chris Alrod, and especially Nicholas Korsbo have really brought this inkling of a dream of, can we automate the modeling, and made it real, right? So, today I'm excited to just say that, everything has really come together, and this is where it's at.
Thank you so much, Chris. I mean, those words mean a lot to everybody who's contributed over the years. And thank you for coming to the launch event. Please stay up towards the end for questions. And I, at this point, would like to introduce our main keynote speaker, Dr. Antoine Sobre. Um, well, you know, I've known Antoine since a wintry uh, afternoon in Baltimore when he, it was almost a blizzard when he came into University of Maryland to talk to us about a potential collaboration. Antoine is a PhD in mathematical physics from Marseille in France. He followed that up with a research fellowship at Harvard Medical School, Mass Gen Hospital, and then he's worked at Novartis, and now he's the a disease modeling expert at Roche, and I think he's heading the disease modeling division. And right from day one, he has been a fantastic collaborator to us, and there's no one else better to invite and talk about the vision of where we are going with regards to Deep Pumas. Antoine, please.
Hi, everybody, and thanks, Vijay, for the kind of introduction. So as Vijay mentioned, it has been a few years where I've followed the development of Pumas-AI with great interest and also collaborating. And during this short presentation, I wanted to give a bit of an overview of, as a user, where I see the potential use case of this new technology. So in this short presentation entitled The Next Frontier, AI in Quantitative Pharmacology, I would like to share some thoughts and my experience on how the latest development in AI could be applied by modelers in the pharma industry. So next slide. Yeah. Short outline. So I will discuss briefly AI in healthcare, generative AI, which is of course a hot topic, and this SciML that Chris and Vijay mentioned. So we can go to the next slide. So here is a short story of AI in healthcare, which was recently published by Google in JAMA. And we classify the development in AI in three big steps. So you have before 2011, what they refer as AI 1.0, which was primarily symbolic AI. And we rely on logical reasoning with if-then rules, encoding in probabilistic model. And a common example would be clinical decision support. And I think systems like IBM Watson from a few years ago were in that category. So helping people based on knowledge really engraved by the domain expert in the system giving advice, right? And the 2.0 happened in 2011. And what was really the revolution of deep learning, which was again a breakthrough from Google with AlexNet, where we developed a convolution neural network capable of accurately classifying images without being instructing on what is on the image, right? And everybody joke about this system able to recognize a cat or a dog, but they were really a breakthrough in developing this technology. And in 2022, we entered the 3.0 revolution, which is ChatGPT, and over large language model, which as everyone has now experienced, can handle advanced tasks like summarizing and writing text or generating images from brief description. And if we apply a similar classification to our current PKPD or system pharmacology modeling, I would say that we are still in version 1.0, where, for example, the way we define the structural model of our model is really based on expert knowledge. It's not yet fully automated. It's really the expert impacting the design of the model. So if we go to next slide, what we see, and if we start with the 3.0 revolution, and that it's on a daily basis now that we are using this AI, this large language model, and they are really becoming valuable model assistant in our daily work. They can very quickly generate codes and script to perform an analysis. And you see on the right of this slide that ChatGPT knows already the Pumas-AI syntax, the language to code the model. And just by one sentence, you can ask him to generate a two-compartment model without much effort, and he will know what we are talking about. So because he has been learning from previous model literature, he knows what to do, how to code such a model. And of course, this general AI can summarize reports, scientific publication, and automate repetitive tasks. And I think they will become even more capable in the near future to perform some of the exploratory data or modeling analysis on our behalf. And these tools are rapidly changing how we work as modelers. We need to stay curious about this new development and continuously learn new skills. Just 2 years ago, I think nobody knew that we would need to become expert in prompting to use this tool, right? So it's really something that in the past 2 years, we have started to learn, and we will need to upskill and to learn new way of doing our work because of these new tools. And if you go to the next slide, what we see is also just the beginning. So these large language models are really poised to become more autonomous with development of specialized large language models. They are now called agent, and they are designed to perform specific tasks. And what you see on this slide is an example from a paper, which is called Clinical Agent, clinical trial multi-agent system with large language model-based reasoning. And what this prototype is doing is able to perform specific tasks. So for example, a user will ask the clinical agent if a trial will be successful if he gives to the large language model information on the drug, on the disease, and on the inclusion-exclusion criteria. And this agent is going to dispatch the problem to other agents. So for example, a planning agent then delegate the task to other agent to analyze these requests, such as safety or efficacy agent, to evaluate the drug's potential safety and efficacy profile, which are then summarized by a fourth agent, which is called a reasoning agent. And of course, the usefulness of these tools will depend very much on the reliability of these different individual agents. For example, for the safety and efficacy, we know that it's very difficult to predict benefit risk prospectively, and it's very challenging. So when we see this development, one of the questions we can ask ourselves is, are all the work we are doing going to become really AI-based? And if you go to the next slide, I would argue that relying solely on AI for drug development is still challenging. First, because of the data size, we know that these AI systems are really data hungry. But there's also the data quality, and also very importantly, we don't necessarily mention it, is the context regarding how the data were collected. And I would argue that one strength of modeling is that we can accurately integrate context and prior knowledge. And as an example, in our modeling, in our simulation analysis, we describe the trial design. We explicitly say how the design has been tried. We can account, for example, on the type of assay. If we have a PK assay, we measure total of free drug. And this information is very important if you really want to understand, for example, the link between exposure and response. And right now, I would say that it's very challenging for an AI system to understand this context. Most likely because the context of how these experimental and clinical trials have been conducted is not fully documented. We know a lot, but not everything is in the documentation. And that's, I think, where modeling and modeler can have a strong impact. It's because we can bring context in a lot of experiment, which is not perfectly documented. So if you go to, again, the next slide, what I would argue is that we need a hybrid approach. So AI is going to be very extremely effective when the data are dense, when the sample size is large, and also when all the meta information to understand the experiment is thoroughly collected. Otherwise, I believe that traditional modeling, the one we are currently doing on a day-to-day basis in the pharma industry, will be more suitable because the modeler can really give all the prior information, all the context to the modeling, and really frame the problem in the correct manner. And if you go to, again, the next slide, I think the future of pharmacology modeling is really lies in the combining traditional models with machine learning approach like neurology. So you will hear very soon about product able to develop this model. And I think this approach is also gaining momentum overall in our community. On the right, I've listed already a couple of publications exploring the potential of this technology. And we recently published with colleagues here at Roche and with a Pumas-AI colleague, a perspective potentially showcasing how this hybrid approach will be very useful for pharmacometrics, especially to uncover disease progression patterns in neurological conditions. And if you see on this example, on the schematic on the left, you can see how different approaches can be combined. So you see that the first equation of the model is a standard PK equation that we manipulate every day, while we don't know the relationship, for example, between biomarker, an endpoint, and the concentration. And this relationship will be discovered by a neural network. So that's really this combination of neural network, ordinary differential that we manipulate on a daily basis. And that's this hybrid approach, which I think will be the future for us on how we bring AI in our modeling. So I'm very excited to see that soon we will have, on a very easy manner, be able to use this approach, making it accessible and easy to use in our daily work. And if you go to the next slide, this approach is also gaining momentum in other scientific fields. I want to mention this very impressive example in weather prediction, where Google have developed a hybrid model combining physics based on physical principles such as air movement, thermodynamic, with a neural network to represent less well-known physical process. So exactly what I just showed you in the previous example for modeling pharmacology. And what was interesting is that this model is not only smaller and faster than a purely physics-based model, but also achieve prediction accuracy on par with the best existing physical model. And what's very interesting is that this hybrid approach outperforms purely AI-based model when applied to new situations, and which is a challenge we often face when predicting outcome. What's going to happen in the next stage, even if we don't have the data. So it seems that this combination of known first principle with AI seems to be the best way to generalize to case study, which has not been seen. And if you go to my last slide of conclusion, what I think we will see is that generative AI is for sure is going to become a big part of our daily work. It's going to help us to make better use of digital information like text and images that we previously could not fully utilize. However, I believe that a purely AI-driven solution still face challenges, particularly because of the data sparsity and missing context detail that we encounter in our preclinical and clinical experiments. And I'm convinced that that type of hybrid approach like neurology that Deep Puma is implementing, which combine AI with traditional modeling, have great potential for creating more reliable predictive models that perform well in extrapolation. And these new approaches also bring the need for a new skill set and new profile. Scientists who not only understand drug development and PKPD modeling, but also who know how to leverage this new technology. So we need some also not only hybrid modeling, but also hybrid modeler who can understand both the subject matter expert, but also really the technology. And I think you can click one time. We are just really scratching the surface here. I can personally say also that the Pumas scientists you are about to meet have put tremendous patience into developing these new tools. And I'm, of course, very excited to see what the future holds with the release of Deep Puma. And you see at bottom right a picture of what the future of drug discovery for ChatGPT. And we are still there, and hopefully with better tools. And I think it's starting today. I think with that, I can hand over to Vijay for the next step of the presentation. You're on mute, Vijay.
Right. So, and thank you for the collaborations over the years. And, I'm sure there are a lot of questions that I can already see coming in for you. So please stay on for the panel session later. And at this point, I would like to go on to our next agenda item and introduce you. In fact, let me just say something. The next few people that you're going to see are the future of pharmacometrics. These are the next superpowers of pharmacometrics. We've been privileged in the pharmacometrics community. It's a small community, and there's so much legacies, so many brilliant scientists over the years. And, as Antoine sort of finished in closing, you need a next generation of pharmacometricians. You need a next generation of tooling to solve the problems that are out there. And I'm extremely proud at PumasAI to have such a team, and I'm very thankful for everybody who's contributed to the products. And most important, I'm going to introduce you to Andreas Nowak, who is the head of product engineering at PumasAI. He's been there, I think, along with Patrick, all the way from when the first few lines of code were written for PumasAI, for the Pumas products. And I'm going to leave the introduction short. Andreas is an econometrics by training, and I'll leave a small tidbit. He is an unofficial World Econometrics Hackathon champion. I don't know what unofficial means, but he is what it is. But today he is here building products for cutting edge pharmacology problems. So Andreas, welcome, and please, the floor is all yours.
Thank you, Vijay. So hi, my name is Andreas Nowak. I am the head of product development at Pumas-AI. We at Pumas-AI launched our first software product, Pumas, back in 2019 with the vision of bringing the traditional pharmacometrics toolbox into the 21st century to allow the pharmacometrician to utilize traditional and new methods together in a modern programming environment that also runs in the cloud. Later, we launched Pumas-CP to simplify the daily tasks in clinical pharmacology, such as non-compartmental analysis and bioequivalence analysis. Today, we are proud to present the latest extensions to our product family. This is the next step in our vision of allowing modern methods, such as deep neural networks and large language models, to be used in companion with well-proven methods of pharmacometrics, such as nonlinear mixed effects modeling. Now, let's have a look at what has come. We will now show two short videos of our new offerings, starting with Deep Pumas, followed by As Pumas. After the two videos, I will introduce some of the key people behind our offerings. But first, the videos.
Today we're launching Deep Pumas, a revolutionary scientific modeling and machine learning system for healthcare data. Deep Pumas bridges the gap between scientific modeling and machine learning, enabling us to utilize biological and physical laws together with data-driven machine learning. This is made possible by seamlessly mixing dynamical modeling, which encodes scientific mechanistic understanding, like molecular interactions, dosing regimens, and drug effects, with machine learning to find useful patterns in complex data, while also using statistical modeling to encode known data hierarchies. This allows us to disentangle common patterns from individual variability, even in heterogeneous data. DPumas is usable throughout the entire pharmaceutical industry, from lead generation and clinical research to individualized patient management. In scientific modeling, we often encounter gaps in our knowledge, unsure of how one model component interacts with another. Rather than guess, with DPumas, we can inject machine learning to identify these missing pieces in a data-driven manner. We've already seen success with this approach in identifying feedback mechanisms in acute myeloid leukemia, which has led to better individualized predictions of patient outcomes and treatment responses. And though we're launching today, we're not the only ones to have been empowered by DPumas. Our collaborators at Boehringer Ingelheim used DPumas to discover feedback mechanisms in a myeloid suppression model. Not only did they improve the predictive performance, it did so while dramatically reducing the time needed for model development. Beyond model identification, DPumas bridges the gap between NLME and machine learning modeling for complex covariates. We have already seen how DPumas can use images to predict individualized patient outcomes, and by leveraging a close connection between random effects and latent variables in generative AI models, we can even generate synthetic multimodal data where complex covariates are predictive of patient outcomes. We ourselves have seen how empowering DPumas is when used for various problems in the healthcare space, including epidemiology, using longitudinal biomarkers to inform a primary endpoint, tumor size, overall survival modeling, and more. But this is just scratching the surface. And looking forward, we're really excited to see what impact DPumas will empower you to have.
Hello, my name is Juan, and I am here to tell you all about Ask Pumas, our AI assistant focused on Pumas-AI and pharmacometrics. As you can see, Ask Pumas provides a web interface to a chat that I am sure many of you are familiar with. However, Ask Pumas is not just any AI assistant. It is one that is focused on your daily workflows and in helping you make the most out of our Pumas-AI products. So let me just jump right into an example. And here I am going to be doing a little bit of cheating because I will paste a prompt that I already had prepared for you. In this case, as you can see, we have asked Ask Pumas to generate a population of 10 subjects which are given a single dose and have some covariates that come from very specific distributions. And right as I am speaking, you can see that the answer is showing up on the screen, so it is very fast. And you can see that we got some explanations, but more importantly, the Julia and Pumas code that we requested, which I'm now going to copy over to my editor. So now that we have the code, let's just go ahead and run it. And as you can see, we get the 10 subject population with the covariates that we requested. Now that we know that Ask Pumas provides code that is useful, let me go back to the answer and highlight some things that I consider to be really interesting. First off, I would like you to notice that it not only gives you code, it gives you explanations and tries to walk you through how it came up with that answer. But even more interesting than that is the last section of the answer, which is labeled as sources. Let's just click on the first link to show you what we mean. As you can see, we're taken to a Pumas-AI tutorial, which is talking about absorption models. But we're not just taken to the tutorial, we're taken to a section which is about generating populations with covariates, as you can see in the code examples. So this is really allowing us to go to our training materials and learn more about how these answers are generated and just Pumas overall. With that, we have only scratched the surface of what you can do with Ask Pumas. So I am very happy to invite you to our upcoming webinars where we can go into a lot more detail. More on that later.
All of this has been a team effort, and I would like to introduce a panel of some of the key people behind DPumas and Ask Pumas. Let me first introduce Nicholas Korsbo. Nicholas was part of the DPumas project from the very beginning, back when the grand vision of combining nonlinear mixed effects modeling with deep neural networks was just an abstract idea. Nicholas has meticulously explored ways of materializing the vision. He has iterated on the implementation over and over to get us where we are today. Welcome to the panel, Nicholas. Next, I would like to introduce Mohammed Tarek, who joined the Deep Pumas team as the product started taking shape. Mohammed has been instrumental in advancing the technical development of Deep Pumas, turning it from a promising concept into a powerful solution. Finally, Juan Oneto created the vision and provided the groundwork for Ask Pumas. Many more people have been part of these efforts, more people that I can mention here. Please read our blog post to learn more. Now it's time to ask the panel about how Deep Pumas and Ask Pumas came about, as well as the challenges and possibilities ahead of us. So Nicholas, you're the first person to start making Deep Pumas a reality. Why did you embark on this journey, and what were you hoping to accomplish?
Yeah, right. So I wasn't really supposed to. That wasn't the plan. I was coming out of my PhD, and it was in the middle of COVID lockdowns, and I was sitting at home with my twin toddlers, and looking for a postdoc. And my goals were really to go into academia and to work on model discovery and model inference. I had problems before, like during my PhD, modeling biological system, and just realizing how incredibly hard it can sometimes be to go from a data set to try to figure out what the underlying mechanism behind that data set is. And so I wanted to do research into how to go about doing this model inference. And then Pumas-AI came along and tapped me on the shoulder. And we realized that we had, our incentives were perfectly aligned. So here at Pumas-AI, starting the Deep Pumas endeavor, I got to work on exactly what I wanted to do, which was model inference. And also, even beyond that, it was also starting at Pumas-AI, we could almost immediately get a larger impact than I could do in academia. I'm much closer to patients here than I would have been otherwise. And this is quite tantalizing in this field, partly because, well, now I get to solve modeling problems that actually helps people, and partly because I know what kind of data is available for every patient that we have. We can gather so much data for every patient, and it's quite hard to utilize it well, but the data exists. And we see a pathway of utilizing it in a much better way. And so therefore, I still see a pathway for a massive impact in the real world. And so that's a very tantalizing idea and a very motivating factor for embarking on this project.
Thanks. Let me turn to you, Mohammed. Can you share some of the examples or case studies where this product has been successfully implemented?
Yeah, sure. So Deep Pumas' development as a product basically has been guided by real projects with real data and real problems since day one. I think Antoine here was a key collaborator who trusted this vision, but him, along with many other early adopters who trusted us to help solve their challenging problems and develop this new technology along the way, basically. And so in fact, many of these projects even led to publications in a number of venues, such as Page or ACOP. We even have a couple of posters in this upcoming ACOP about some work that was done with Deep Pumas. But just to give some examples, so one project that I helped with was actually mentioned in the video earlier. It was about improving the famous Freiberg model. And so what we did was we wanted to modify it because it wasn't quite fitting the data right. And we knew most of the structure in there we wanted to keep, but then by adding some neural networks to key parts of the model, we were able to improve the model's predictive accuracy significantly and actually match a model that was manually developed by an expert modeler over almost 6 months. And that project was mostly done by an intern with some support from our side. And so obviously the client was very happy with that. And so that's just one example by which Deep Pumas can help accelerate your model development and create predictive models that are on par, if not better, than what an expert pharmacometrician can develop. Another project that I was also part of was developing a joint tumor model, tumor growth and overall survival model to fit more than 6,000 subjects across 9 studies of different combination therapies. And we actually have a poster about this in the upcoming ACOP, so please come and stop by. But basically what we showed was that this model with, again, deep Pumas as the core technology was able to outperform the reference model that was sort of the best model that was being used by the client at the time. And we were still able to demonstrate significant improvements over that. But these are just a couple of projects that I was part of. My collaborators have been working across multiple different other projects spanning ophthalmology, epidemiology, and neuroscience. And every project obviously comes with its own unique challenges that we learned a lot from, but also helped shape the product as we were developing it. And so even though you look at it today as a new product, but it's actually been a few years of development effort and also using the product ourselves to make sure that it's ready for you to also be using.
Thanks for that. What are some of the technical challenges you faced while developing the product, and how did you overcome them?
Yeah, so it is a new tool that we were developing, so naturally it comes with a lot of technical challenges. And in fact, one of the things that drew me initially to the Deep Pumas product, so I was not initially part of the team, but I joined the team, I think, almost a year after it started. The effort started to develop Deep Pumas, and one of the things that drew me was the complexity and the technical challenges required to, or that we need to solve in order to develop this product and to make it useful in real life. So I think one particular challenge that was kind of bugging me all the time is how do we really bring together nonlinear mixed effects modeling as a field, as a concept, to machine learning, and how do we connect these two fields? I think a lot of people in our field, but also in the machine learning domain, they think of these two areas as sort of two separate islands that don't really have much interaction. Maybe more recently, we started seeing more interaction between machine learning and nonlinear mixed effects modeling through something like neural differential equations and scientific machine learning, or even developing covariate models with machine learning. But I think more fundamentally than this, what we realized at some point is that what we call nonlinear mixed effects models are essentially what the machine learning community calls conditional generative models. And so there's actually an exact parallel to what we do in the machine learning community. And this idea, this unification of the two fields, what it allowed us to do is actually gave us a lot more clarity of thought when developing the product, and allowed us to choose the algorithms that are rooted not just in the theory of nonlinear mixed effects modeling, but also in the theory of machine learning, and sort of build a product that is not just familiar to a pharmacometrician and tries to bring a little bit of machine learning to the pharmacometrics community, but more build a bridge between these two fields, and a product that allows you to explore all of the power that machine learning has to offer, again, starting from this conceptual unification of the two fields. And I do believe they are essentially one and the same in terms of the concepts being explored in both of these fields. It's just that we use slightly different terminology. And so Deep Pumas is more than just a product, I believe, that combines or gives you a little bit of machine learning to put in your models, but it also, I think, allows you to reorient your thinking so that you can reason both about the machine learning concepts you are using and the new machine learning tools coming out, and also about your nonlinear mixed effects modeling techniques that you are already used to, and sort of bring them together in a nice, coherent way.
Thanks. Let me return to you, Nicholas. I know you are very future-oriented, so I wanted to ask, what excites you the most about the future of Deep Pumas and its role in evolving pharmacometrics over the next few years?
So there's quite a lot that excites me here, and there are a lot of quite separate things, I think. So one of them is technical, and then in terms of capabilities, what kind of impact we can have, what kind of data we can utilize. And so we've already gone into using longitudinal biomarkers to inform a primary endpoint. I think that's cool already, but I want to take that a step further. And so using like this connection that Mohammed talked about for between generative AI models and NLME models, taking that to using longitudinal multimodal data to inform your primary endpoints. I think that's a medium-term goal of ours that I am very excited about. And so that would be essentially like in oncology today, you take the sum of longest diameter is the way that you measure tumor sizes. And then you try to relate that to survival. But like these sums of longest like tumor sizes or some of longest diameter, they're coming from images, right? And what if there's something else in those images that are more predictive than just this very crude metric? And so I would like to go into this multimodal space where we can use longitudinal multimodal data. And that's just one example of the technical capabilities. But then beyond the technical, I think there's also another kind of shift coming. So partly like educational, like the technology doesn't do anything unless anyone uses it. And partly, I think it comes to like a regulatory and data management point of view as well. The more capable we are of extracting value from data, the more incentivized we'll be to revise our regulatory frameworks and the way that businesses manage their data and share data and how that becomes available. So I think I'm hoping for a good acceleration, not just a steady pace of development, but an acceleration where you go hand in hand with increasing capabilities that also lead into increasing data availability and like better infrastructure around data use. And I think that will take us to the next level much faster than we might have thought. And so that's exciting.
Thanks. Now let's talk about AskPumas. Juan, what inspired you to develop AskPumas, and what problem does it aim to solve in the field of pharmacometrics?
Of course, my inspiration came from seeing the great potential of large language models, which I am sure all of our attendees have seen, and we heard Antoine talk a lot about it. I have seen how these tools can transform the way they work, and I have always been very interested in these tools that can improve our productivity. However, the thing that stood out the most to me was how we could use AI to support learning and mastery. I have been involved in a lot of education activities here at Pumas-AI, and I have firsthand both seen and faced the challenges that you get when you're learning a new tool and trying to make the most out of it. And that is where I wanted AskPumas to make a difference. I want AskPumas to be something that both new and experienced users can use to engage with our tools more effectively and unlock their potential to innovate. AskPumas is essentially the tool that I wish existed when I faced these challenges myself, and I am really excited to be able to give this back to the community.
Thanks. How do you see the role of generative models evolving in the pharmacometrics over the next few years?
So the landscape of generative AI and large language models is evolving incredibly fast. Basically, every day we get a new breakthrough. And I believe that the role of these tools and models in pharmacometrics is just going to grow more significant over the years. I think that these models are not just about improving efficiency, but they are also changing the way in which we tackle problem solving and information access. Of course, here at Pumas-AI, we are committed to staying ahead of the curve. So that's something that we really want to do. But one of the key goals for us is to integrate Pumas in as many aspects of our users' workflow as possible. We want it to be always there for you, whether you're creating a population, as you saw in the video, making a simulation, or writing your reports. Pumas should be there for you all the time. And just looking ahead, I am also very interested in how these tools can be really customized, and we can help users get the most out of them with their own information, but in a secure and private way, which is something that is really moving forward in this landscape.
Thanks. Let me finish this session with a question for you, Mohammed. Besides the product launch, you've also been working on a new online course on AI for drug development. Could you say a few words about what motivated you on developing this course?
Yes, so yeah, indeed, we've been working on this plan for a complete online course on AI for drug development, or AIDD as we call it. The idea originally came from Vijay, our CEO, who wanted us to basically give back and contribute to educating the next generation of drug developers on the various AI concepts that are useful in drug development. Now, we all know that AI is a very big field with many, many branches. And so what we did was we wanted to sort of boil it down, and we set out on this mission to identify what the key concepts are from AI and machine learning that we believe, given our experience developing the various AI products we have at the company, that we believe those concepts have a great impact on drug development. But beside our own experience, we also try to do a thorough literature review to understand where the current AIDD research is, where the community is currently heading in terms of research trends, and then also boil it down into the key concepts that we need to teach or we feel the next generation of pharmacometricians need to know in order to be empowered to use this new generation of tools, including DPUMAS, of course. So our AIDD course will be tailored to drug development based on the current research trends, and it's not a generic machine learning and AI course. All of our case studies will be drug development case studies, the data sets, drug development data sets, and hopefully when you take this course, when it's announced soon, you should be a much more well-informed and well-prepared user of any AI product, including DPUMAS or Ask Pumas or any other product out there. So it is a public service that we are trying to do, and hopefully it attracts good attention.
Thanks. With that, I'd like to thank the panelists. Now my colleague, Dana Goody, Head of Business Development, will share some more details on how to learn more about our new offerings.
All right. Thank you, Andreas. Good morning, afternoon, evening, everyone. I'm Dhanashree Goody, Head of Business Development at Pumas-AI, and I have the floor for the next 10 minutes. It's wonderful to have you all here, and I want to thank you for the incredible response. We have had more than 250 registrations today. Your enthusiasm and support mean the world to us, and we are excited to share this moment with our dedicated community. Today's event is a result of hard work by many teams at Pumas-AI. First, I would like to extend my heartfelt thanks to our business development and operations team who worked tirelessly behind the scenes to make this success possible. From posting on LinkedIn and managing our events page to coordinating countless reach-out efforts, your dedication and relentless drive has been instrumental in achieving this milestone. A special thank you to our exceptional product development team. The success of today's launch is a testament to the passion and commitment you have invested in bringing DPUMAS and Ask Pumas to life. It has been inspiring to witness the energy and dedication you bring to every use case, project, and presentation involving these tools. Your commitment to innovation has fueled the incredible response, and we couldn't be prouder to work alongside such a dedicated team. Next slide, please. To keep this momentum going, we are thrilled to announce a series of webinars on DPUMAS and Ask Pumas. These sessions will provide an in-depth look at each tool's features and capabilities, showing how they can optimize pharmacometrics modeling and clinical pharmacology workflows. Our first DPUMAS webinar is scheduled for December, followed by the Ask Pumas session in January. So look out for these registration links in the coming weeks and visit our events page for updates. You can also scan this QR code on the screen to sign up to get notifications when the registrations open. We hope these webinars provide an interactive opportunity to explore these tools and to answer any questions you may have. Next slide, please. We are excited to share that we'll be exhibiting at the American Conference of Pharmacometrics ACOP 2024 at Arizona this year, and you will find us at booth number 1. If you're attending this conference, please stop by to discuss how DPUMAS and Ask Pumas can support your projects. We are also conducting a 2-day pre-conference workshop on scientific modeling, augmented by the machine learning with DPUMAS, which is going to be taught by no other than Nicholas and Mohammed, whom you just heard. I know several of the attendees today have registered for this workshop, and so we look forward to seeing you there. We're also thrilled to announce that Nicholas from our team will be moderating an ophthalmology symposium along with scientists from Genentech and Roche. And his symposia title is Advancing Ophthalmology in Historical Insights and Advancing Modeling Methodologies. Apart from this symposia, Pumas-AI will be also presenting 3 posters at ACOP as listed on the screen in the areas of DPUMAS and Ask Pumas. So if you're at ACOP again, please join us at our booth or at the poster sessions to discuss how our tools can elevate your work in drug development. Next slide, please. Moving on into the next year, in 2025, we will be expanding our educational offerings with both virtual and in-person courses on AI drug development, especially for applications in pharmacometrics and clinical pharmacology, as discussed by my colleagues just in the panel discussion by Mohammed and Andreas. These courses will provide practical, hands-on training on AI and machine learning to enhance data analysis and predictive modeling across disciplines. The first in-person workshop on AI in drug development, which we like to call AIDD, will be held in Basel, Switzerland in the month of April 2025. The second workshop is planned for December 2025 and will be conducted at Manipal University in India. Additionally, we will be launching an online course in AI drug development, offering foundational modules covering the fundamentals of machine learning, neural networks and SciML, and generative modeling and deep NLME. This course is, of course, free. However, if you want to take your learning to next level, the paid version includes dedicated office hours with Deep Pumas experts, project-based assessments leading to a certificate of completion. So whatever is your level of interest and whatever is your end goal, we look forward to you signing up for either the free online version or for a paid version. Please scan the QR code on the slide to join our mailing list so that we can keep you posted on these offerings. Next slide, please. As a part of our commitment to advancing the field and to train scientists across the globe, we are thrilled to announce the upcoming workshops hosted in partnership with leading universities worldwide. So we are bringing the training to you to empower you to take advantage of these tools to innovate in your drug development process. Our hands-on workshops will include dedicated training on Pumas, Deep Pumas, and PumasCP, which are some of the other tools from PumasAI, helping participants to learn how to utilize these Pumas products for pharmaceutical modeling and simulations. As you can see on the screen, we are offering these workshops across the worldwide, and some of the workshops are happening in Germany, in Malaysia, in California, in Orlando, in Thailand, Spain, Boston, and South Africa. And sign up definitely for our newsletters as well as sign up forms so that you get more updates on as we keep adding more and more workshops. So we really hope to see many of you over there at these workshops. Next slide, please. Moving on, I really would like to celebrate today's launch and show our appreciation for all of you being here. And so we are excited to announce several raffle giveaways. We are giving away free seats as well as discounted seats at these workshops that you saw listed on the previous slide. These offers will allow more participants to benefit from our comprehensive training programs at either no cost or at a reduced cost. For our clients who are existing clients for Pumas, for either Pumas or PumasCP, they can win free compute time, enabling them to run more simulations and analysis without any additional expenses. This is a great opportunity to maximize the use of our software and enhance your projects. And finally, we are also offering gift cards, which is a versatile reward for both the personal as well as the professional use. So we are thrilled to share these giveaways as a token of our gratitude, and we hope they provide an extra layer of excitement as you engage with our products. Coming to my next slide and my last slide, as a final thank you, we are offering an exclusive promotion valid till the end of this year. Here's what it includes. If you reach out to us before the end of this year, you will be getting a priority demo scheduling. This priority access to personalized demos tailored to your project needs. Our experts will walk you through some real-world applications and demonstrate how Deep Pumas and Ask Pumas can optimize your pharmacometrics and clinical pharmacology processes. Not just that, we will be also giving you an exclusive pricing. So please reach out to us at the earliest to avail special rates on product codes for both Deep Pumas and Ask Pumas. This limited pricing will allow you to explore these tools in a way that aligns with your project goals, whether you are scaling up an existing pipeline or integrating advanced modeling and AI into new initiatives. To top it off, we are also offering one-time free one-on-one consultation with our Deep Pumas experts for free. In this consultation, they will discuss specific project challenges, explore advanced functionalities with you, and you will receive a tailored advice on how to best utilize Deep Pumas within your development workflows. This offer is an exceptional opportunity to experience these tools under the best terms, so please reach out to us at info@pumas.ai to take advantage of it. Our team is ready to help with any questions. Next slide, please. And finally, as we bring today's event to a close, I want to extend my sincerest thanks once more. Your support and enthusiasm has made this launch special. We are looking forward to continuing this journey with you. With that, I'm happy to open the floor for your questions and would like to bring back Vijay and the panel team back into the webinar. Thank you so much.
Thank you so much, everyone. Right. So we'll now get into first of all, everybody, I just want to remind you that this was a team effort, and thank you to everyone at Pumas-AI, product development team, the business development, the scientists, the operations team, the project managers, everybody. You guys have made it possible, and everybody who's been a part of Pumas-AI in some part of the other. Thank you. There are a lot of questions out there, and we've been trying to answer as much as we can. And Antwa, thank you for answering some of the questions that already came to you. I will pick a few questions so that we can get there. One of the questions is about access to academia. I just wanted to make sure that I'm happy to tell you that all the products at Pumas-AI are free to all academicians. And you will see that Deep Pumas is going to be released and available to you, to your universities as a cluster-based license and probably other forms of activity. So please keep a lookout to us, and please write to us about it. And it's not just for Deep Pumas; any other product at Pumas-AI is available. There was another question about from Dave, who talks about, he recently read an article about model interpretability for AI in healthcare, and if curious if we have any tools at Pumas-AI to talk about model interpretability, especially if you want to take these complex models to clinicians and patients alike. So I know we are almost at the top of the hour, but I think the questions are really cool, and for the attendees, if you want to stay on, please, we'll have a slightly extended Q&A. So I'm going to ask Nicholas to answer this. Nicholas, do you have any thoughts on model interpretability and how these complex models could, we can make it simple for clinicians and patients alike?
Well, yeah, there's lots of answers to this one. So I'm sorry, you picked a hard one.
Short and succinct.
Short and succinct. Okay. So first off, I think part of the scientific modeling that we already do, they already have some kind of problem in them. And I don't know that we're exacerbating the problem as much as people might think. And this is also, I would also say that the approach that we're taking here is not a replacement of scientific modeling at all. Everything that you can do for nonlinear mixed effect model, all of the plots, the VPC, the whatever you do, like all of that can be done in a Deep Pumas model as well. So all of your classical sort of checks and balances and diagnostics that work for nonlinear mixed effect models and have been proven for years and years and years, they're still applicable, right? We're embedding machine learning in NLME. We're reaping all of the benefits from past work into validating models and creating trust.
Yeah.
So I guess that was a short version.
Thank you. I actually have a question for Antoine here, because it's important to get an industry perspective, again, short and succinct if possible. But there is a lot of buzz about AI and ML, and they want to make an impact in the pharmaceutical industry. How much of it is actually turning into something that is making an impact? Where is the pharmaceutical industry in looking at this as a visionary thing to something that is achievable now?
Yeah, I think everybody in the industry is asking where they should go. I think the clear impact is what we already know on images, for example. If you want to segment images, that's replacing pathologists, radiologists. So that's clear impact. This large language model on writing document, it's clear that's the future. But what I wanted to show also in my presentation, there is still limitation because of the size of the data, and I think we need to combine both. And I think that's what your approach, like the deep NLME, is going to bring. It's a tool which can handle at the same time the sparsity of the data that we have in our clinical trial. It's difficult to collect data in patient, but when we have huge amount of data, we can use AI. And I think that's this hybrid. I think that's for me the future, at least right now. In 50 years, maybe we'll collect all the information needed and it will be purely AI, but I think we are far from it, I would say.
Okay, thank you. Thank you for that. One last question to Mohammed here. So there's a question from Dave asking, how does Deep Pumas handle the variability in PK/PD data, particularly with patient-specific factors like genetics and comorbidities that could affect drug response?
So as I was saying, I think Deep Pumas or Deep NLME is really an extension of your existing NLME concepts. And so just like in regular NLME, additional covariates can help you predict patient responses better without observing any data yet. Sort of the observation or the prediction and baseline is what we call the PREDs usually. I think having more rich and more complex covariates essentially can enhance the predictive power of your model, so that as a patient walks through the door, you don't need to actually be observing them for a while before you're able to individualize the predictions for them. You can just take a few measurements at baseline, and then that should give you enough information to make accurate predictions over long term. Now, ideally, we have all the information we need to make perfect predictions, but that's usually not the case, and there's going to always be some portion of unexplained variability, and that's where the random effects are essential, basically, in these kinds of models, and that's why we try to bring the two together, neural networks and random effects, in one model or one modeling framework.
Yeah, thank you. So moving on to just a couple of more outside Deep Pumas, more general questions that I wanted to bring to the table. We've been talking about pharmacology, all through this presentation, but Chris, you have an idea of the potential impact that a product like Deep Pumas can have, not only in pharmacology but throughout the drug development process. And Nicholas alluded to that in his presentation, that whether it's in manufacturing or whether it is in omics or whether it is in health economics research. I mean, we have examples in epidemiology. So Chris, maybe very shortly, could you talk about the impact that a core technology like SciML can have across the entire drug development process?
Yeah, I mean, in the entire drug development process, right, we know a lot of things, but there's a lot of things that we don't know, right? And really what it's allowing us to do is to be able to say, let's take everything that we know and figure out what we don't know in a very, refined and kind of driven kind of way, right? Before there's a lot of guess and check. You have to go check the literature. Why was our prediction wrong? Could be such a hard question. But now, Deep Pumas and the scientific machine learning tools really turn it into more of like a, hey, most likely the problem's over here. So now go check, go check, this gene. You didn't know that this gene was involved. Go check out all the literature on there and you go, oh, hey, look, I got a hit, right? It's much more directed search. And I think that, that kind of directed search can be used all throughout the entire process.
Nicholas, do you want to answer that? Just a quick minute on
that. Sorry, I'm answering questions in the chat here. I wasn't listening.
All right, sorry, go ahead. That's all right. That's all right. So lastly, Juan, you've been part of the Pumas team since the inception, and you've seen the challenges, the growth, and what do you envision one of the most challenging things going forward for Pumas, especially as the ecosystem of large language models evolves on a day-to-day basis, pretty much?
So I think these tools are good if they can be personalized and they can fit to your needs. So I think the main challenge here is being able to take advantage of all of the data that people have and be able to use them effectively in a secure way, of course, because there are often times where we don't want that data to be shared with anyone. So I think there's a combination of these two aspects, both making good use of the data, but doing so in a way that is acceptable.
Yeah. And Andreas, are you ready to tame this team who is so passionate and ready to go do everything under the sun, but somehow we need to meet our deadlines and get through the products.
Yeah, that's of course always the challenge when there's a lot of ideas around. So the process of making them into solutions requires a lot of hard work.
Yeah. So with that, I think we went over a little bit of time. We have a lot more questions that we will definitely answer as the time goes on. And Danu, thank you so much for summarizing to everyone how they can reach out to us and what do they get out of this. And as a final vote of thanks, first of all, I would like to thank Antoine for agreeing to come and speak to us. Thank you for collaborating and trusting us. Thank you, Chris, so much for all your efforts over the years into the Julia and the SciML ecosystem. And everybody at PumasAI, thank you so much. But more importantly, to all the attendees, you are seeing here the future of pharmacometrics, the tools and the people out there. So we're here to stay. We are going to give you guys tools that will make a difference. And I'm looking forward to interacting with all of you in the future webinars. But those of you who are coming to ACOP, yeah, I'll see you at the bar there. Take care. Thank you.